Ovarian cancer is the 5th leading cause of cancer deaths in women in the U.S. However, few women ever recognize the early symptoms, and so the motto, "Until there's a test, awareness is best," highlights the need for more women to recognize the early symptoms of the disease. Joining me to discuss what women need to know is Dr. Danica Moore. Dr. Moore, great to see you again. Thanks for being here.
Thank you.
Tell us the importance of women becoming aware of ovarian cancer. There doesn't seem to be a huge awareness at this point.
Well, the issue is for years we told women this was a silent disease. So they thought there was really nothing that they could do about it. We thought it was a silent disease because we thought there weren't really dramatic symptoms of early disease. And they're not dramatic, but they whisper. They're not silent. They whisper. They're subtle. So you have to really listen to your body. And then you have to go to your gynecologist to make sure she listens to you.
And why is it so important that you catch it at the beginning?
Well, like any cancer, the earlier you treat it, the better your chance for successful outcome. Unfortunately, most women aren't diagnosed until stage 3, when it's very likely to have spread already, which makes treatment much more difficult.
Absolutely. Okay, so what are these symptoms that whisper?
Well, and the symptoms are subtle, and I want everybody to know these are symptoms of many other things. So if you have these symptoms, don't panic, but call your doctor and make an appointment.
Right.
And the symptoms are persistent bloating, not just the week before your period, but bloating for a few weeks that doesn't go away, or a sense of abdominal fullness, or increasing girth.
So
many
weight
women
gain.
say, well, some women actually lose weight while their bellies are expanding. So one reason they don't think it's a problem is because they're happy about the weight loss.
Yeah.
But they also, one of the reasons they're losing weight is they have this sense of fullness, so they don't need to eat as much to feel full. They also may have urinary frequency or urgency, and that's from the ovaries growing and pushing pressure on the bladder. And they also may have abdominal or pelvic pain. Some women even have leg pain. But the pain is typically during or after intercourse, and they may occasionally have some abnormal vaginal spotting.
So if you have any of these symptoms, go to your doctor
Absolutely.
right away.
And you
Don't
may
panic.
have one, or you may have a combination.
Now, are there certain women that are at a greater risk of ovarian cancer than others?
Yes. First of all, like many cancers, the older you are, the higher your risk. The average age of ovarian cancer is 63. However, 5% of women with ovarian cancer are under the age of 34. So don't think that just because you're in your 20s or 30s, you can't get this yet. Women who've never had children, either by choice or because they've had infertility, are at greatly increased risk. Of course, women who have a family history of ovarian cancer or breast cancer are also at increased risk. That's because of the genetic connection, particularly with BRCA1 or BRCA2 abnormalities. If you personally have had breast cancer, you may also be at increased risk for ovarian cancer. And then if you've had endometriosis, you may also be at increased risk.
And who is at the lowest risk?
Well, this is interesting. First of all, if you have your first child before the age of 30, you have a decreased risk, and then you get an increased reduction. It's like a tax benefit for every successive child you have. And then you get a bonus reduction benefit if you breastfeed for more than 12 months. And that's in total from all your children.
So not just for one child.
Right.
Okay, so you
and
can add it
then
up.
women who've been on birth control pills for more than 5 years, numerous epidemiologic studies, over 45 studies from 21 countries, have shown that women who've been on birth control pills for over 5 years have up to a 50% risk reduction, and that risk reduction benefit persists for 30 years.
That's very interesting. Is that enough to just prescribe birth control pills simply for this reason?
There are some doctors, and I would be one of them, who would recommend going on birth control pills to a woman who has a family history of ovarian cancer, assuming she doesn't want to get pregnant. And of course, nobody chooses to have a child just to reduce your risk of ovarian cancer, but you can choose to be on birth control pills for that purpose.
Are there any other sort of proactive steps a woman can take?
Well, that's the best one.
Yeah.
The most surprising proactive step, there are lots of nutritional things that can help you. The most important nutritional thing is to maintain a healthy body weight, because if you have a body mass index or BMI over 30, you are also at greatly increased risk. So diet and exercise is important for everything, but here's another reason. But drinking tea is the most surprising study that has been done in 61,000 Swedish women. They found that women who drank 2 cups of black tea per day had a 46% risk reduction for ovarian cancer.
Specifically black tea.
Well, that's because that's what they drink in Sweden. So
right.
there was actually a similar study done in China where they just happened to drink green tea, and they found similar results. and women who drank 1 cup of tea a day had about a 24% risk reduction.
How does the coffee factor in, right?
Well, there's many questions. Is
Yeah.
it because they're not drinking coffee? Is it because women who drink tea do tend to be healthier? And of course, women who drink tea tend to be non-smokers. They tend to do yoga and other things. This was just intriguing. For now, the birth control pill is the best choice for proactively reducing your risk. However, having a tubal ligation can reduce your risk of ovarian cancer by 67%, and having a hysterectomy, which again you would never elect to do unless you had another medical problem, can even reduce your risk of ovarian cancer by 20%.
And now, what are the survival rates of ovarian cancer if you catch it early enough?
Well, if you catch it early enough, the 5-year survival rate is over 80%.
Okay.
However, all of this data varies significantly, depends on your extent of disease, how healthy you are, how soon you get medical treatment, etc. The most important thing for women to know is it's important to have your GYN exam, your internal exam, every year. And if you have any abnormal symptoms between your annual exams, call your doctor and discuss it.
Your doctor checks for ovarian cancer in a normal visit?
There's no test for ovarian cancer. In a normal visit, when your doctor does the internal examination, that's called a bimanual examination, one hand inside, one hand outside, we're feeling for your ovaries. And if your ovaries feel an abnormal size or shape or consistency, your doctor would generally order what's called a vaginal ultrasound test, and the ultrasound can actually visualize the ovary. Of course, unless they do a biopsy, we wouldn't really know if you really had ovarian cancer.
Thank you so much, Dr. Dunica Moore, for highlighting the need for awareness about ovarian cancer.